Good morning, YouTube. I thought I would come back and tell you guys how I actually was diagnosed with the LGL, which is large granular leukemia. I was scheduled for ankle surgery. So you know how you have to get the pre-operation testing, which consists of a physical exam. You have to get your blood work done, an EKG. Okay, I go in, I see my primary care physician, which I've had this primary care physician for probably about 15 years. And, you know, he does the EKG. And he says to me that your blood work came back and it looks like you have rheumatoid arthritis, but your white blood count is also low. You're going to have to go see a hematologist. So I say to him, what do you think is wrong with my white blood count? And he said, I think you have something in your blood. I'm going to schedule you for a hematologist. So I had the appointment within probably a week or so. It wasn't long. So when you go to the hematologist's office, they do your blood work first, and then you go in and you talk to the doctor. So they drew my blood, so that I guess that way they could have the results. So they drew my blood. I went in, the doctor came in, he was very nice. He started asking me questions. He said, you know, your blood work came back and it looks like you have rheumatoid arthritis. And because the RH factor was high and my white blood count was low. And I said, yeah. And I said to him, I was also looking it up. And because of the high RH factor and because my white blood count was low, it said, of course, on the internet that it's probably Felty's disease, which is a complication of rheumatoid arthritis where your white blood count would be low and your RH factor would be high. So he asked me questions. He wanted to know that I have night sweats. Well, of course I have night sweats. I'm 50. Who doesn't sweat at, you know? Was I fatigued? Sometimes. He wanted to know, was I getting any type of infections? And yes, my sinuses. It seems like for the last couple of years that I was always having a sinus infection where I had to go into the doctor, get antibiotics. It seemed like it would go away, and then maybe a couple months later it come back. So I've been fighting sinus infections. He asked about family history of rheumatoid arthritis, and yes, I have an aunt that does have rheumatoid arthritis. So generally when you have a family member that has an autoimmune disease, which I didn't know really, that the likelihood of somebody else, you know, getting it then is really high. So he said, I want you to come back in 2 more weeks and, you know, we'll talk about it some more. We'll run some more blood work because I guess the blood work that they had to run, it took just a little bit more time to get, you know, different results that were coming in. And of course, when you have an online account with your doctor, you get all your blood work. So as the blood work is coming in, I'm looking at it online. I'm trying to diagnose myself. So, of course, I really don't know what I'm looking at, but I'm thinking to myself, it's still Felty's disease, which is the complication of the rheumatoid arthritis. I go back in, I see him again, probably about 2 weeks, and he came in, and he said, he sat down, and he said, we figured out what you have. And he just said it. You have large granular leukemia. It's called LGL. Well, I wasn't expecting that. I couldn't move. I couldn't budge. I felt like I couldn't believe it. He said that when he's actually explained it to me, when your white blood cells, they look granular under the microscope. And I'm still sitting there like I just couldn't believe it. But to get more, I guess, diagnosis than just the blood, they would have to do a bone marrow biopsy. So I was scheduled for the bone marrow biopsy. After I received it, I went back probably like maybe another week or so. And he came back and he said it's definite that it is LGL and it's not the Felty's disease. But because I have the neutropenia also with that, with the white blood count, that I would need treatment. So my treatment had to start right away. So when I think about the treatment, I'll have to come back and let you guys know what the treatment was. Oh, the treatment starting off, it was, okay. So the next time I come back, I'll let you guys know. Okay, thank you. Have a good day. Bye-bye.